RSV is a very common viral infection and it affects the respiratory tract, so the ears, nose, and throat. It's so common that most children have had it by the age of 2. RSV is most common in the winter months. It usually peaks in January and February. The signs and symptoms of RSV in older children and adults usually mimic the common cold. It gives you a cough, runny nose, mild headache, and fever. In more serious cases, RSV can cause wheezing, can cause a bluish coloration of the skin, and can cause difficulty breathing. In infants, it can cause difficulty breathing, shallow, rapid breathing with irritability and poor feeding. RSV is spread just like the common cold through droplets from other people. The virus can actually sit on hard surfaces, so it's very important to wash the hard surfaces at the home, clean toys frequently, to make sure you wash your hands. General, basic precautions are the best way to prevent the spread of it. Young infants, premature babies, older adults, and people who are immunocompromised. RSV can cause pneumonia and bronchiolitis, which is an infection of the smaller tubes of the lungs. This, for infants, can be difficult because they have a hard time fighting off the infection because they don't have a very strong immune system. Premature infants are even more at risk because they do not have a developed immune system. So RSV can be treated at home. Parents can use saline nasal spray with some gentle suctioning, frequent feedings, pushing fluids, rest. If the child has a fever, you can give them Tylenol. If the child is over 6 months, you can give them either Tylenol or Motrin. It's very important to not smoke around your child. This puts the child at risk for more respiratory problems, including RSV. Parents should seek medical help if they think that their child is having any respiratory distress. Signs of respiratory distress include nasal flaring, grunting, their skin turns a bluish color, or if they are using some of their extra muscles in their chest to help them breathe. Those are signs of respiratory distress, and you would want to get help right away.